Right, a warm welcome to everyone from Geneva, Switzerland. I'm Reda Sadki from the Geneva Learning Foundation here with Charlotte and Boo today for the Gavi Zero-Dose Learning Hub. If you don't know what that is yet, well, stay tuned. We'll tell you all about it in 57 seconds. And you're going to hear from participants who are immunization staff working at all levels of the health system, how they are using the Gavi Zero-Dose Learning Hub and its resources, its country learning hubs, in order to translate knowledge, shared experience from fellow practitioners into practice to identify and reach zero-dose children. So that's coming up in just 30 minutes. If you're a francophone and understand English, the French session will be in around 25 minutes. See you in 20 seconds. All right, countdown would be 10 seconds. We like to do this. There are right now literally hundreds of zero-dose practitioners in the room from all system levels. We have global partners with us as well as country partners, especially for Uganda and Nigeria, but also from Mali and colleagues from Bangladesh as well. So I'm Reda Sadki. We're kicking off this Insights Live following the second inter-country peer learning exchange that was held on the 13th of September. We're specifically interested in today knowledge translation following this inter-country peer learning between two countries, but with 90 countries, practitioners who are focused on zero dose from 90 countries listening and learning. 2,203 participants from 90 countries registered, contributed in some way, participated in some way to the event. 86% of them directly involved in zero dose, most coming from subnational levels, but also good participation, 30% from the national EPI and 13% from international partners, almost a third women participating. And then the feedback has just been amazing. You're telling us that this event helped increase your commitment, you learned something new, you're planning to use what you learned, you'll join the next event, and you're going to invite your colleagues. We're going to focus today on this question of applicability, also known as knowledge translation, looking at Gavi's IRMA framework. How are you, zero-dose practitioners from all system levels, country partners, international partners, using the power of peer learning in order to identify, reach, but also to advocate, monitor, and measure? We're going to turn to Rebecca Okello, who will be our first to speak from Uganda and to ask a simple question. Rebecca is going to introduce herself and then tell us in 1, 2, maybe 3 sentences, what was this Zero-Dose Learning Hub inter-country peer learning exchange for you, Rebecca? A warm welcome.
Thank you. Greetings to everyone. I'm Rebecca Okello. I'm a public health nurse, directly involved with immunization in my health facility. The Zero-Dose Learning Hub, I see it as an eye-opener to my performance in immunization and also a major knowledge bank. Because whenever I go on this forum discussing, sharing with others, I see that the challenges that I meet can be undone by getting the knowledge, how people have implemented it, integrated it into the existing service delivery, and then they achieve results. So I'm grateful to the team, to the Geneva Learning Foundation and Gavi for introducing this kind of knowledge bank that enriches our performance and also helps us to see what we are, where we are, what we should be in order to achieve results of not missing any child. And in the long run, we prevent the diseases that are communicable. Thank you.
Thank you very much indeed, Rebecca Okello. We'll now go to Lily Mutua. Lily Mutua is from Sokoto State, Nigeria, works at the district level. I'm hoping that her connectivity is holding up and that we'll be able to hear from Lily. Are you able to unmute? Yes, Lily, a warm welcome. Tell us what you do in Sokoto State in your district, and then tell us what was this Zero-Dose Learning Hub X exchange for you on the 13th of September. What does it mean to you? Oh, I think Lily has muted again. All right, let's go to Aliyu Kane. Okay, Lily, go ahead, please.
Sorry, Reda, I'm from Nairobi, Kenya. Can I continue?
Oh, yes, my apologies. Yes, please go ahead. Oh.
That's why I muted again.
Yes.
So what I've done is that I found through this platform, there's a lot of learning. The experiences that we have learned, there are those people who are already practicing what we have learned on the forums. I've also been privileged to see what global perspective look like in the other African regions and even in the Asian countries. However, we could be very different in different geographical positions, but we have identified through our conversations that we need to have a 360-degree looking at the advocacy part, looking at the data, looking at service delivery, and bringing our consumer at the core. So what I've been able to do, because my work entails mainly on demand creation, I've been able to liaise with the service delivery teams, the EPI, the expanded program immunization managers within the sub-counties, and even at the county level, which is the sub-national level, and look whether we are getting the 0 doses and whether, if we get, what is the root cause. Because whatever impends one not to get immunization in one household is very different from the other. We live in the capital city of Nairobi, yet during our previous polio campaign, which was done 4 weeks ago, we find that we are also still having 0 doses. So we need to understand why the 0 dose. Is it a knowledge gap? Is it an issue to access? Is it an issue of maybe values, beliefs, cultures, or what is that real problem? So using that data that we are getting from the service delivery side, we are able now to come up with reasonable strategies to address, 1, the access issues, 2, the service delivery point, maybe the time that we are delivering the services, how friendly the services are for the consumer, and whether the community itself understands the benefits and importance of having every child start their immunization schedule at the appropriate time, and also ensuring that they finish all the doses as required. So for me, it has changed me now from just purely doing demand service for the service delivery, but purely to an advocacy part at all levels with the policy makers, with the decision makers in the community, and also with the implementers at the sub-national level and national level. Thank you, and over to you.
Thank you very much, and my deepest apologies because I confused you with Aliyu Kane, who is from Sokoto State. Lily Mutua, thank you for opening this Insights live session. You are from Nairobi County in Kenya, of course, where you are the head of health promotion, and indeed, participants, practitioners from 90 countries participated in this exchange focused on Nigeria and Uganda. Now we can go to Aliyu Kane, who's from Sokoto State and works at the district level. Aliyu, apologies to you as well. Tell us who you are, what you do, and then tell us for you, what was this ZDLH-X on the 13th of September? What does it mean to you? And again, 1, 2, 3 sentences, because we want to then deep dive into what we're learning.
Thank you very much for giving me another opportunity to speak to this good gathering. The ZDLH for 13th of September, I was able to gain a lot of knowledge from the colleague from both my country and Uganda, and other comments from countries that people were able to participate in. One of the things that I learned is that previously we used different methods and different strategies to reach out to those zero-dose children, but unfortunately, we were not able to reach out to those children as we intend to. That is based on the percentage. We use what we call area intensification as well as the state outreaches. But in all of these activities, we normally engage state officials, LGO officials, and sometimes 1 or 2 personnel from the facility level, as I used to work at the district level. But the performance is not as we expected. But while joining this, especially on 13th, I understand that where we have a lot of gaps is from the micro planning. We do micro planning, we review the micro plan from each facilities, but unfortunately, during implementation, we were not able to implement up to the expectations. But when we start to engage the community levels, that is the leadership of the community, both the rural leaders as well as the religious leaders, we start to see results compared to what we have previously. So I learned a lot that you can learn from someone even outside your country and implement what they are doing and achieve your results. And sorry for not introducing myself. I'm Aliuk, and as I have said before, I work at the district level and I'm from Sokoto State. Thank you, and over.
Thank you very much indeed. So we're talking today about the 13th of September inter-country exchange between Nigeria and Uganda, but with practitioners, immunization staff from all systems level, national, subnational, listening and learning together with country partners as part of the Gavi Zero-Dose Learning Hub. 2 topics we focused on: integration, and second topic was microplanning. You just heard Ali Ukane from Sokoto State explain what that meant to him. Now we've selected a few, we've pulled out a few quotes. 100, you have been very, very great in numbers in sharing your learning and insights following this event. And here we have, for example, Gojenom Sani. I'm going to ask Charlotte to read for us a couple of these testimonials. Meanwhile, we're looking for raised hands if you'd like to answer the questions about what you have learned and how you are applying it. Charlotte?
Thanks, Reda. This quote is from Gojenom Sani from Nigeria, who says, "Hearing different strategies and how it's applicable to some communities helped me reconsider understanding the communities we work in."
And then this from someone who works at the regional level for UNICEF, so we ask for your consent if you would like. We would like to name you and honor you, but in some cases you choose not to. Charlotte, what did this woman from UNICEF tell us about her learning, her experience of ZDLH-X2 inter-country peer learning exchange between Nigeria and Uganda?
What I found interesting is that colleagues in other countries use the same strategies I use to reach out to the zero-dose children. And this proved to me that I was on the right track and should even do better to reach every child. I also learned that community engagement is very important in these interventions because they are the users of the services.
I will look at one last one before we go back to the ZDLH-X partners who are with us in our studio. This one is from Oche Mansour from Nigeria. What did Oche Mansour want to tell us?
He says, "I was moved when I heard the experiences and strategies used by health workers in tracking zero-dose and missed children in communities through dialogue and community engagement, and also identifying influencers who can bring on board mothers together their own immunized children to accept immunization services."
Thank you, Charlotte. And this is just a couple from hundreds of pieces of feedback, insights, telling us what you are learning, what you are doing with the learning. This is a process some call knowledge translation, and that's what we're looking at in today's Insights live session, exactly 2 weeks after the inter-country peer learning exchange. Now, I see we have 4 questions. What did you learn about zero-dose from your colleagues? Did anything surprise you? How did participation in ZDLH-X affect your professional practice? How are you maybe begun to use, because it's only been 2 weeks, what you learned in your own zero-dose work? And do you have something that you want to share with Gavi and other colleagues about your zero-dose work where you work? So we are going to go to, let's see, so Mikhail Olabanji. I see Charlotte has already unmuted Mikhail. Mikhail, introduce yourself and then tell us which of these questions would you like to answer? What do you want to share about your experience of ZDLH-X 2?
Good day, everyone. I'm Olabanji Mikhail from Nigeria, Quality and Patient Safety Manager, Fifty Hospital, Nigeria. Glad my wife to participate in the last Gavi Zero-Dose intercountry learning.
So Olabanji, you seem to have a lot of background noise. Can you speak closer to your microphone and louder so that we can hear you better?
Thank you very much. I'm Olabanji Mikhail.
Much better. Yes.
Fifty Hospital Quality and Patient Safety Manager. I'm very much glad to participate in the last Gavi Zero-Dose Learning intercountry learning.
Great. So what did you learn about zero dose from that event? Did anything surprise you?
Yes, the most surprising revelation was the power of community engagement and micro-planning in reaching zero-dose children effectively. Understanding the vital role of village head and mobilizer in child registration and follow-up was a game changer. It made me rethink the importance of involving stakeholders at grassroots levels. The event reinvigorated my motivation and commitment in immunization efforts. It also reinforced the idea that every child health matters. It's a collective responsibility to ensure that they receive these life-changing vaccines. I now view healthcare as a collaborative endeavor where community participation and data-driven micro-planning are paramount. That is that in my workplace in Fifty Hospital, Lagos, Nigeria, and I promise to use what I've learned so far from all the stakeholders, and also beyond. I will prioritize the community involvement, refine our micro-planning processes, and strengthen partnership with local and mobilizers. Thank you very much for the opportunity.
Thank you very much indeed for sharing. Now we should hear next from someone from Uganda, so we can alternate between countries, and then in addition to that have participants who are not from either of the two focus countries that were honored on the 13th of September. We know this with 90 countries participating, this event had a significant impact for outside, beyond the borders of Uganda and Nigeria. Charlotte, so let's see. Ismail Sidi Ali is asking, still has a hand raised. Ismail, over to you. We'd like to hear from someone who is from Uganda. If so, please raise your hand. Okay, and Michael Jones. Yes, let's have a perspective from Sierra Leone. Michael Jones, you work in EPI, but I believe you're going to introduce yourself and then tell us, what did you learn about zero dose from the event on the 13th of September, from the learning process? Did anything surprise you?
Yes, I just want to say thanks for the opportunity, and it was a good experience to hear some of the things that from colleagues. So one good thing is that Sierra Leone has done a zero-dose assessment, and which we did earlier this year, which also enabled us to apply for the equity accelerated funding. And critical things is that on how we will reach our zero-dose children. And so from that session on the 30th of December, that some of the things that we've worked on, some of the things that we put in the application that we submitted to Gavi were things which we had from other people that were mentioned during that program. So it gives us confirmation that what we have put in our documents for implementation is also something which other countries have practiced, and it has worked well for them. So for us, what we've done so far, even though we have not yet got the approval from Gavi on the EF, but one critical thing is that we have integrated our COVID with our routine immunization, wherein we organize periodic intensification of routine immunization, PUI. And since COVID is having the fund, we use the COVID fund to reach out to children in hard-to-reach communities, in zero-dose areas, especially wherein you need more resources to get these children and get them vaccinated. So we've integrated COVID with the routine immunization, And we also have strengthened our healthcare workers to do that defaulter register and then to do it on a regular basis and have engagement with the CHW within their catchment area. So on a monthly basis, our CHW and our health facility do meet on a monthly basis, look at the defaulter register and give these people who have defaulted to the CHW to go out in their communities and able to get these children. So by the time the team comes in, the team comes into the community, they are already there for vaccination. Additionally, what we've also have done is that we've engaged community stakeholders, our local traditional people, our paramount chief, our section chief, our chiefdom authorities, and tell them about the need of children to be vaccinated. They have instituted bylaws in their various communities, wherein these bylaws will force parents to make sure their children are being vaccinated. In the urban area, we've tried as best as possible to see in our implementation plan to have flexible opening hours for big clinics. In a sense is that the clinics will also be open in a flexible hours, maybe on weekends, and then also even after 5 to enable our working class mothers and caregivers to able to go out to the hospital to get their children vaccinated. And those in the slum areas, slum communities, wherein we find that the trade has been a situation that has stopped them not to able to get their children vaccinated. Most of them are market women. They go early in the morning and come in the evening. We deploy vaccination team at the market center, at market location. Mobile teams who go there and vaccinate the children whilst their mothers are busy in the community. So this has been a great situation and opportunity for us where we have worked so hard to get our zero-dose children being vaccinated. And we've seen improvements. Even though we country was having 25,000 zero-dose children, but then we've seen that in a little basis, some of the efforts we've done, we'll be able to reach some of those children and get them vaccinated. And we've engaged our stakeholders, our religious people, those in the mosques, to also talk to our communities. And those nomadic communities and settlements, we have mobile teams who go into those communities, get social and peer facilitators or supervisors, and then we have used a community-led approach where in the community plan immunization session with the health facility. Community give the availability
Thank you, Michael Jones.
of the facility of the people based on their occupation or whatever their religious status, and ask the vaccination team to come there. So it has been a community-led approach. And one thing we've also have plan to do is to have a bottom to top micro planning with the involvement of community stakeholders. This is something we've started, but we want to see how best we can improve on it, to have community participation in the micro planning right down at the village level, chiefdom level, district level, and this is validated before it comes to the national level. So this is something which I think will help us in our implementation of our EAF once it's approved by Gavi to reach out to more zero-dose children. And
thank you, Michael Jones. That was quite complete.
We minimize the number of zero-dose children and put some of the strategies into our routine.
Thank you, Michael. I just remind all speakers that there are many more people, many hands raised here, and appreciate, Michael Jones, you sharing such a comprehensive picture of your plans and what you're implementing in Sierra Leone, and also how you are reassured to hear what other countries are doing. Now we only have 3 minutes left in this Insights Live, where we are talking about knowledge translation, the process through which, following the inter-country peer learning exchange between Nigeria and Uganda, you are now translating that knowledge into action. We have, I believe, Brenda, Harriet, and Nsima, who's going to be our last speaker. Brenda, do introduce yourself. Tell us who you are, what you do, where you work, and what did you learn about zero dose, and did anything surprise you?
Okay, good afternoon to you all. Good afternoon, good morning from wherever you are. My name is Brenda Nsima Harriet. I work for WALIM, supporting the Ministry of Health in Uganda at regional level. In my main activities are in EPI. I look over routine immunization and surveillance activities for vaccine preventable diseases. While supporting routine immunization, in my region, there's a marginalized community of the pygmies, and also people around them the zero doses that we found in the region that I support currently were around that area of the marginalized communities. So the approach to have them covered is been moving house to house, because this is a mobile community. They are here today, tomorrow they're in a different place, which becomes a little hard to follow them through with the community network. So the facilities nearby take outreaches specifically for them and move house to house to look out for those that have missed vaccination. And also the volunteers in the community, they...
It sounds like Brenda Harriet Nsima has lost her connection.
Mobilize the children
she's back.
who are...
Brenda, I'm going to have to ask you. We have less than 1 minute. So please conclude.
Yeah. All right. Yeah. So what's catching that I picked from this and the strategy is that for the community that is having mostly the zero doses,
I believe
it's important to get but also move out to them house to house and then outreaches. Over to you, Reda.
Thank you, Brenda, and apologies. So we keep these short because we know you are busy, and many of you are returning back to your daily work of doing the daily work of vaccination. So we are now at the finish line for this Insights Live, and I hope that we have left you thirsting for more. We'll be announcing soon what's coming next for Zero-Dose for the Zero-Dose Learning Hub. The global Zero-Dose Learning Hub will be at Teach to Reach 9 on the 13th of October. Last one, there is 16,835 participants, primarily immunization and other primary healthcare staff, plenary sessions, one-to-one networking, and alongside the Gavi Zero-Dose Learning Hub, we'll have a UNICEF plenary session. They're our anchor partner for Teach to Reach on identifying and reaching zero-dose children with vaccines in urban and peri-urban settings. Together with, of course, the global learning partner will be there as well. So that's it for this Insights Live. We're now going to switch over to the Francophone, to the version in French. Thank you once again for having participated. And we have to end quite abruptly because of a back-to-back French language session. If you did not get to speak today, do not despair. We'll have other events, other activities, other ways in which you can share your experience, share your knowledge. Want to especially acknowledge the Zero-Dose Learning Hub contributors who've shared their experience before, during, or after the ZDLH-X events. Thank you and goodbye.